Okay, so this is an active mobilisation technique for someone who has some impingement or some pinching type pain on hip flexion. So this is a progression from more of the passive techniques that you may have seen before. So we're going to use a mobilisation belt, which will then go around our patient's hip, around my waist to get some leverage. So we'll pass this through. I'll connect the buckle. And then we're going to position that belt as high up into the groin as we can, so it's nice and high against the joint line itself. I then get my hips at the same level as her hips. I place one hand on the side of the ilium, not blocking the femur, but just holding the ilium, and one hand on the knee for stabilisation. She places a hand on my shoulder for balance, and then when I say go, she's going to lunge forward, which will put her hip into flexion, and at the same time, as she lunges, I'm going to apply a lateral glide with the belt, gliding the hip into an open position. As she'll glide forward, she'll come back, and I'll release the glide, and I'll apply it again, and she'll move, and we'll come back and we'll repeat that a few times. So glide goes on, she lunges forward, I move with her, maintain that lateral glide pressure, come back, glide goes off. Glide goes on, she lunges again, coming back, glide off. One more time, glide on, lunging with her, moving in time with her body, glide off. And the idea is that we're opening up that joint, creating space, so that as she lunges into that position where she would normally get the impingement, we're going to reduce that pressure, open up the joint, make it a nice, smooth, painless movement for her hip.